Welcome everyone to Raaonline. So today we have a very important topic, the diving disorders. In year 2023, DNB Emergency Medicine paper 1 third question is regarding this diving disorders. Okay, this is going to be a very gray area which you cannot write whatever you like, right? So other questions you will be able to answer, but this area is one thing where you can score. Okay, there's only limited content, but if you write properly, you can score literally full marks, right? So this is diving disorders for you. So what is the most common diving injuries? So they are classified as this: barotrauma of descent, barotrauma of ascent, decompression sickness, immersion pulmonary edema, oxygen toxicity, and nitrogen narcosis. What do you mean by barotrauma of descent? From the sea level, when the particular candidate dives inside, what happens to his body? Because of the pressure and volume differences and changes, what happens to his body is called as barotrauma of descent. Okay, when he comes up from the water level, when he comes up to the surface, what happens to him is barotrauma of ascent. Okay, you can also tell this as from the surface level when he goes in a flight towards a high altitude. That's also called as barotrauma of ascent. Then is the decompression sickness. We'll see that in detail. This is very important. This was the question asked in your DNB Emergency Medicine paper 1 2023 paper. Okay. So next is going to be the immersion pulmonary edema. We are not going to look much about this immersion pulmonary edema. It's one of the findings. So it need to be handled like how you handle the regular pulmonary edema. Some NIV, some oxygen support, conservative management is more than enough. Then we'll look into the oxygen toxicity and nitrogen narcosis. We'll have just one word about it. But very important is barotrauma of descent, barotrauma of ascent, and decompression sickness. So whatever question they ask, either it's about point 1 or 2 or 3, the first step is you need to write all the 6 in your first point itself. Okay. So start your answer saying that most common diving injuries are the descent, the ascent, decompression, immersion pulmonary edema, oxygen toxicity, and nitrogen narcosis. Now, before understanding what actually happens to the patient, you need to know 3 laws: the Boyle's law, Dalton's law, and Henry's law. Okay, what does the Boyle's law state? It tells you that the pressure and the volume are inversely proportional. This is what Boyle's law states. Okay, at a constant temperature, the pressure and volume are inversely proportional. Meaning, if the pressure doubles, the volume will be halved, or if the volume doubles, the pressure will be halved. This is the relationship. Okay, this is called as Boyle's law. Okay, so given a constant temperature, the pressure and volume of ideal gas are inversely related. That is, if pressure is double, the volume gets halved. Okay, it is stated as P1 V1 is equal to P2 V2. Okay, so why are we reading this Boyle's law here? Okay, we'll go into it. So 1 atmospheric pressure is equal to 760 mm of Hg. Okay, this is a fact. You need to know this. So a seawater, if at all this particular candidate is actually a diver in a seawater, so 1 atmosphere of pressure will increase every 33 feet depth he goes inside. Okay, this is the mean sea level. Okay, and the diver dives inside. So for every 33 feet, the pressure increases to extra 1 atmosphere. Okay, so what I am trying to tell is at the depth of 33 feet, what will be the pressure? The pressure is 1 atmosphere here, and additionally there will be 1 more atmosphere because he has jumped 33 feet down. So at the depth of 33, it will be 2 atmospheres. Got it? So for every 33, you need to add 1 along with what you get at the sea level. Okay. So the pressure exerted at the depth of 33 feet in seawater is equal to 1 atmosphere for the seawater plus 1 atmosphere for the atmosphere above the water. So totally it's going to be 2 atmosphere. So now what will be the pressure over him at the end of 66 feet? At the end of 66 feet. Okay. So for every 33, you need to add 1, right? For 66, you need to add 2 atmospheres. Right? On the surface, you already have 1 atmosphere pressure, which we all live now, right? So 1 plus 2 is 3. So at the depth of 66 feet seawater, he will have 3 atmospheric pressure acting on him. Okay, this is for seawater. If it is for fresh water, it is every 34 feet. Got it? So for every 34 feet inside the water, there will be 1 atmospheric pressure you need to add. For seawater, it is 33 feet. For fresh water, is 34 feet. Right? So now, a diver is at 165 feet of seawater. Okay. So how much is the pressure? Is 6 atmospheric pressure. How? For 1 atom, 1 atmospheric pressure for every 33 feet of seawater, right? So that gives you 5 atmosphere plus 1 atmosphere for the sea level. So it's totally 6 atmospheric pressure. Okay. So 33 into 5 is equal to 165. That's why we get it. Okay. So you need to add 5 along with the sea level 1. So it is 6 atmospheric pressure. So what I am trying to tell is, because of the density of the seawater, as deep you go, the pressure is going to increase. This is a fact, right? So now comes your Boyle's law. If the pressure increases, what will happen to the volume? It's going to decrease. So how much is going to decrease? It is inversely proportional. What did I tell you? If the pressure gets doubled, the volume will get halved, right? So at the sea level, the pressure is 1 atmosphere. At the depth of 33 feet, the patient or the candidate is going to experience 2 atmosphere, right? So actually, it has doubled. From 1, it has gone to 2. It has doubled. So at 33 feet, whatever cavity, whatever volume the body has is going to half. So this is the concept, right? So as the diver descends in the water, the volume of air containing structures is going to decrease. For example, if the lung contain volume V at the surface, that is when he is standing along with his friends in the seaside, the volume of the lung is going to be V. And a diver who descends to 33 feet of seawater, holding his breath tight, so now the volume will become half, right? Because at 33, the pressure is going to be 2 atmosphere. From the sea level of 1 atmosphere, now it has doubled to 2 atmospheres. So when the pressure is doubled, the volume gets halved. So the volume is going to be half of the original volume at the depth of 33 feet in a seawater. Fine. So now, if the diver then breathes compressed air, so now he is able to breathe. So once he breathes, he'll be able to bring the lung back to the original volume, that is volume V. Okay. So is the points clear? I'll explain you again. So here is ground level. Here is 1 atmosphere. Okay. So here the volume of the lungs is V. Now the particular candidate jumps inside the seawater. This is 33 feet. Okay. So now how much is the atmospheric pressure which is acting at this level? It is 2 atmosphere, ATM, right? So compared to 1 atmosphere, now he is exerting a force, he is receiving a force of 2 atmosphere. That is, the pressure has doubled. So what will happen to the volume of the gas inside his lungs? It's going to be halved. So it is half the volume. So this is what he'll be facing at the end of 33 feet. So now his lungs is a very mobile structure, right? Expandable structure. So now with his compressed air, he is breathing voluntarily. So once he breathes, he will be able to breathe adequately to bring the volume back to V. Got it? So now the issue is, this patient or this candidate with the volume V of his lung now comes back to the surface with his circuit very closed. He is not exhaling. Okay, now he is coming back to the surface. So what will happen? So in the surface, the pressure has been halved. From 2 atmospheric pressure, he is coming to 1 atmospheric pressure, right? So when the pressure decreases, the volume should increase, right? So when this candidate comes to the surface level, this volume of gas which is inside his lungs, see, this is his lungs, right? This is his lungs. The volume of gas inside his lungs is going to get doubled. So it's going to be like a ballooning out or bursting out. Okay. So this will create barotrauma. Okay. So this is the logic behind why a patient can develop the barotrauma. Okay. So 1 atmosphere is the sea level. At the end of 33 feet, the patient is going to experience 2 atmospheric pressures by the Boyle's law. Here, if the volume of the lung is going to be V, that means the gases in the volume, gases in the lung is going to be V. At the depth of 33 feet is going to be half V. Okay. So this is the lungs. This is the lungs, and he started with the full 100% air. Just assume 100% air. At the depth of 33 feet, the gas volume has decreased to half of it. Okay, that is half V. So now he has adequate space to breathe more air. So from his compressed circuit, he is breathing more air and is maintaining to V. Okay, full volume. So now this candidate is coming back from 2 atmospheric level to 1 atmospheric level, where this V is going to get doubled. So he is going to have 2V, 2 volume, twice the volume what he had now. So at the surface, he is going to develop severe barotrauma. So this is why he might feel little comfortable inside the water, But once he reaches the surface, he will have a lot of tightness in the chest where he will develop more and more symptoms. Okay. So this should be the understanding. So now as the diver descends in water, the volume of the air containing structures will decrease. For example, if the lungs contain volume V at the surface, a diver who descends to 33 feet of seawater holding his breath would have a lung volume of half V. If the diver then breathes compressed air, this half V can be made into a V. If the diver then ascends to the surface without exhaling, the lung volume now become 2V at the surface. Okay. So next is the Dalton's law. So this tells you that total pressure exerted by a mixture of gases is sum of the individual partial pressures of individual gases. Okay. For example, there is a composite of gases. There are 3 gases. Okay. Gas A, gas B, gas C. Okay. If the total pressure increases, it means that individual pressure also increases. That's all it says. Okay. The total pressure exerted by a mixture of gases is the sum of partial pressures of each gases. Okay. The total pressure increases, it simply means the pressure of the A, B, C also increases. Okay. This is what it indirectly tells us. Now coming back again to our scenario. Okay. So our patient is there at the sea level, that is 1 atmospheric level. Now he has jumped inside to 33 feet seawater. Okay. So the pressure has increased to 2 atmosphere. Okay. So now whatever air he is inhaling through the compressor circuit, whatever it is, that pressure also is increasing. That's what is called as increasing pressure, right? So increased. So what this Dalton's law says is, whatever mixture is there inside his compressed air complex, each and every gases, each and every A, B or C, partial pressure also is going to increase. That's all it is. So more deeper he goes, more pressure is what he feels, and more is going to be the partial pressure of individual gases which he is breathing in. This is what is Dalton's law. So if ambient pressure increases, the partial pressure of a given component of a gas mixture will increase. Okay. But the proportion of the gas in the mixture remains always constant. If he is taking 1:1:1, it is always 1:1:1. Okay. The proportion is not going to change, but the partial pressure will increase proportionally to the total pressure. Okay. So A plus B plus C, the pressure of A, pressure of B, pressure of C is equal to total pressure. That's all it is. So how severe and how significant is it? The partial pressure of nitrogen in air at sea level, it's 600 mmHg. Okay. But at the end of 99 feet sea level, this is called FSW, is feet sea level. Okay. Or feet sea water. The partial pressure increases by 4 times. Okay. But at the end of 99, the atmosphere is going to be 4, right? You know the reason, right? 99 divided by 33 is equal to 3. This is the additional atmospheric pressure. At the sea level means plus 1, right? So from the sea level only he is jumping. So 1 plus 3 is equal to 4. So 4 times whatever the nitrogen is giving us in the sea level, he is going to face at the depth of 99 feet. Okay. That is from going from 600 mmHg, it's going to 2400 mmHg is going to be the partial pressure of nitrogen. So such severe is going to be the partial pressure of nitrogen. So why are we reading this? Why are we worried about the partial pressure of nitrogen here? Comes the third law to answer your question. At equilibrium, the quantity of gas dissolved in a liquid is proportional to the partial pressure of gas. So what does it tell you? The more the partial pressure, more the gas is going to dissolve in your fluid. Okay, got the point? So more is the partial pressure, more is going to be the dissolving tendency of that particular liquid. So now going back to the previous slide. So at the sea level, the nitrogen has a partial pressure of 600 mmHg. Okay, so that will dissolve to a certain extent. But when he is dropping down to 99 feet deep inside the seawater, the partial pressure of the nitrogen increases. So once the partial pressure increases, the dissolution constant, the dissolving capacity of the nitrogen also increases. So nitrogen is going to get dissolved in the body liquids, especially I'm telling about the blood. It can be any liquid, right? So this is stated by the Henry's law. So with the Dalton's law plus Henry's law, this explains the uptake of inert gases into tissues when breathing compressed air at depth. So this is the backline of decompression sickness. So what actually happens in the depth? So this is the sea level. Imagine this is a sea water. So when he goes inside at the depth, the pressure, because of the density of the water, the pressure increases because the water has a density, right? So pressure increases. Once the total pressure increases, what will happen? The partial pressure of individual gases also increases. Once the partial pressure of individual gases increases, the dissolution constant, I mean the solution capacity, mixing capacity of that air into the water or the fluid increases. Okay, this is what happens at the depth. So now, when you get a patient, what you need to do? First thing is evaluation of the diver. Ask the diver complete dive profile. So time, how long he was inside, how deep he was inside, number of dives done is one or multiple, and type of breathing gas he actually used, what is the composition, mixture, everything you need to ask. This is about the particular person. So you need to ask about the dive itself, level of exertion, difficulty in equalization, any equipment difficulty, any history of rapid ascent. All these things are very, very important. Okay, level of exertion, how exertion he did, what is the depth he did for all these things. What is the difficulty in equalization? What do you mean by difficulty in equalization? Okay, difficulty in equalization. Have you ever felt that your ears are blocked? So sometimes we close our mouth and do some Valsalva maneuver so that by a eustachian tube you open up the middle ear. So that is called as equalization of pressures. Okay, the deep sea divers usually when they feel some fullness, they usually do this kind of equalization procedures like Valsalva maneuvers, and they try to keep the pressures equal between two different segments, maybe the ear, inner ear or the middle ear. So this is called equalization techniques. Okay, was that difficulty in equalization? So can it be done only by these Valsalva maneuvers? Is there anything else? Yes. So these divers will have a set area where they need to stay a little more time, and then only they can go deep. They cannot go deep at one full stretch. They cannot go to 330 feet at one full stretch, right? They need to go, take a stop, take a break at one particular depth so that the body can accommodate itself. Then they can go to the next stop. Then they can go to the next stop, like how we go in bus in the road system. The same is true for the deep sea system as well. So you can't just like that dump directly to 1000 feet. You have to stage yourself so that your body get accommodated and then only go. So was there any difficulty in equalization in each of these steps is also to be a question. Okay, any equipment difficulty and any history of rapid ascent. So why is it important? Why you need to ask the history of rapid ascent? As you already know, at the depth the pressure is going to be very high. The volume is going to be very low. When he is coming up very fast, okay, from the severe pressure, from the increased pressure, he is going to come to a relatively normal or safer pressure, right? So when the pressure decreases, the volume is going to increase. So suddenly he will have a lot of symptoms. So we'll see all together now. So starting the first point, what we saw is the barotrauma of descent. When a candidate jumps inside the seawater, what will happen? So it is 5 things you need to write in an exam, which is barotitis, external ear squeeze, sinus barotrauma, inner ear barotrauma, face, tooth or dry suit squeeze. So what is this barotitis? Okay, so when you descend, volume in the contained space it decreases. This is what we were telling, right? So when you descend, do we have, yeah, we have a rough page here. So when you descend, for example, so now what happens? So this is the sea level. Okay, so when you descend 33 feet, okay, here it is 1 atmosphere, here is going to be 2 atmosphere. Okay, so when you descend, whatever the pressure is going to increase. When the pressure increases, the volume is going to be halved, right? So when the volume, for example, imagine the ear surface. Okay, this is the pinna, external auditory canal, okay, the tympanic membrane, the middle ear cavity and the inner ear cavity. Okay, so this is the area which I am speaking about. Okay, this is the area speaking about. Okay, this has a connection with the eustachian tube to the nostrils, right? Fine. So this area contains air, right? So at the end of 2 atmospheric pressure, when the pressure increases, the volume will decrease. So eventually the volume of gas present in this box, that is a middle ear cavity, will decrease, right? So when the volume is decreased, for example, this is your middle ear cavity, and the volume has decreased, the volume of the air inside it has decreased. There's a lot of vacuum there. So when there is vacuum, what will happen? It will try to suck everything inside, right? You will try to suck everything inside because there's going to be vacuum. Whatever air present inside that middle ear cavity, the size has been halved, decreased. So when the volume of the gas is decreased, there's going to be a lot of vacuum. That's going to cause a sucking effect everywhere in all the 4 corners, right? So what usually we do is we open up this eustachian tube. By Valsalva maneuver, we open up this eustachian tube. Once you open up the eustachian tube, additional air goes inside so that it fills the middle ear cavity. Simple. But if this eustachian tube is blocked, then additional air cannot go inside. The sucking effect is going to be very severe. The tympanic membrane is going to be bulged inwards. Moreover, the mucosal surface, whatever is there, is going to be ruptured. It can even lead to rupture of tympanic membrane as well. Okay, is the concept clear? Right? From the sea level of 1 atmosphere going to a depth of 33 feet will increase your pressure. When the pressure increases, the volume of any particular gas will decrease. So, this particular human being who has gone to 33 feet deep in a seawater, the middle ear cavity will have certain volume of gas. So, that particular certain volume of gas will be halved or decreased. Once the volume is decreases, there will be a lot of vacuum, right? So, this vacuum will have a negative suction effect. If at all the eustachian tube opens, there's additional gas goes inside, it will fill and the patient be comfortable. If the eustachian tube is blocked, then the sucking effect is very severe, that the tympanic membrane is going to be stuck inwards, all the mucous surface is going to get ruptured, and whatever nerves going here, the facial nerve passes through the middle ear cavity, remember that. So, even that can get damaged, okay. So, barotitis, descent, volume of air in the contained space decreases. So, middle ear pulls the tympanic membrane inwards. So, what the driver does, he does the Valsalva. So, additional air will enter, he gets equilibrated. If he fails, prolonged pain and injury to the tympanic membrane results, and this results in barotitis or ear squeeze. Okay. What are the clinical features of barotitis? Pain or fullness without otoscopic changes, or can be hemorrhage within the tympanic membrane, or hemorrhage into the middle ear cavity as well with hemotympanum. Ultimately, the TM can get ruptured, the tympanic membrane can get ruptured. Once the tympanic membrane gets ruptured, he will have a relief of pain because the pressure gets equalized between the external auditory canal and the middle ear. So, once the pressure equalization happens, he will feel relaxed, but he will lose his ability to hear. Okay. So, once the TM ruptures, it can cause influx of water into the middle ear, which can cause contamination, number one. And second, because of the temperature of the water, calorically involved vertigo can happen. Imagine that you get vertigo while standing on the road or standing in your house itself, will be very panicky, right? So, it is happening at the depth of 66 or 100 feet below sea level, you get vertigo, then you're going to get panic and there's a chance you may drown. Or what will you do? If you get panic at the depth of 66 or 100 feet below sea level, you will try to come up very fast. This fast ascent is equally dangerous for the same reason which I told you. Okay. So, what are the treatments? Analgesics, decongestants. If there is rupture, give antibiotics. Refrain from diving until the perforation heals, and of course, do a ENT proper consult. And if it's without perforation, you can refrain diving until he is able to equalize the pressure. He can make his eustachian tube work so that he will be able to equalize the pressure. He needs proper mode training, and then only he can dive. Coming to external ear squeeze. What is the external ear squeeze? If the external canal is occurred by a cerumen or a ear plug, okay. So, this is the pinna, this is the external auditory canal, okay, this is a tympanic membrane. So, now here is a cerumen, okay, that's a wax, that's plugged in. So, now this itself is a cavity, can you see that? There will be air here also, the same mechanism happens there as well. So, when the patient goes deep inside like 33 feet or 66 feet, when the pressure increases, the volume of gas present here will decrease. Eventually, there will be a lot of vacuum. This vacuum will again suck things inside. So, the tympanic will be moved outside. You got the point? Okay. So, if the external canal is occluded by cerumen or an ear plug, inability to equalize pressure between the external canal and the tympanic membrane, it causes bending of the tympanic membrane outwards. This causes external ear squeeze. Okay. Of course, the patient can have pain and tympanic membrane hemorrhage as well. Any strain over the tympanic membrane can cause hemorrhage. This can also lead to rupture. Now, third is sinus barotrauma. So, what is sinus barotrauma? Okay. So, if the ostia to the sinuses are occluded, air cannot enter the sinuses during descent to equalize the increasing pressure. For example, see this, I am drawing the frontal sinus. Okay. When you see the X-ray of the skull, the frontal sinus usually looks like that, right? This is a X-ray skull. Okay, this is a forehead, this is a maxilla, maxillary opening, maxilla here, zygoma bone, and mandible and stuff. Okay. So, if you see the frontal sinus opens into the nasal cavity, right? Almost every sinus opens into the nasal cavity directly. So, whenever there is any pressure change inside the sinuses, it gets equilibrated through the nasal cavity. Now my question is, this particular individual from the sea level is going deep. From the sea level, that is 1 atmosphere, is going to a depth of 33 atmosphere. Okay, and consider this as his frontal sinus. Okay, this is opening into the nostril. This is opening into his nostril. Okay, so this is the frontal sinus. So when this candidate goes to 33 feet, that is 2 atmosphere. So the volume of air present inside the sinus is going to decrease, right? The volume of air inside the sinus is going to decrease. Okay, so it needs more volume. So there will be vacuum created. It has suctioning effect. So what it does, from the nasal cavity, it gets more air so that it can fill it up. But in case this ostia is closed, if this sinus opening is closed and it cannot get more air into the sinuses, this vacuum which is being created there has a negative suctioning effect, so that this mucosal membrane will go for rupture. And the patient can have this complete tearing of the mucosa can happen. The patient can develop the blood flowing out of his mouth and his nose and into the mask as well. Okay. So if the ostia of the sinuses are occluded, air cannot enter the sinuses during descent to equalize the increasing pressure. Leads to pain and mucosal edema, submucosal hemorrhage, stripping of the sinus mucosa from the bone, and hemorrhage, often causing bleeding from the nose into the mask. Okay. And rarely paralysis in the infraorbital nerve division. Whatever nerves which is going through these structures, let it be the middle ear cavity, let it be the sinuses, can also equally be damaged. That is true for the facial nerve as well. Yes, because of the middle ear, its relationship with the middle ear. So that also has only conservative management, give decongestants and antibiotics. Now coming to the IEB, the inner ear barotrauma. Okay, so where is the inner ear? So this is the pinna, and now you have the eustachian tube, you have the tympanic membrane, the middle ear box, and now comes the inner ear. Okay, the inner ear. Now comes the inner ear. So now we are going to see the inner ear barotrauma. It has two mechanisms. The injury to inner ear has two mechanisms. One, if a driver attempts to forceful valsalva maneuver to equalize the middle ear against an occluded eustachian tube, what will happen? For example, this is a eustachian tube, right? It is eustachian tube. This is middle ear. Okay, this is inner ear. Okay, so when this candidate has gone to 33 feet deep, the volume of gas present in the middle ear cavity has been halved. So there's a lot of vacuum, there is suctioning pressure. So what he is trying to do, he is trying to do the valsalva maneuver and opening his eustachian tube so that extra air can go inside the middle ear cavity, right? So when he's doing this valsalva maneuver, you can try on yourself. When you're doing valsalva maneuver, you'll feel that your intracranial pressure is increasing. Okay, when you try forcefully the valsalva maneuvers, you can feel that your intracranial pressure is increasing. Okay, so intracranial pressure increasing means the pressure of the CSF also increases. So where does CSF come in this diagram? It is actually in the inner ear. CSF flows inside. Okay, there is direct connection with the CSF as well there, because there is some secretory granules which has direct connection with the ICP as well. So if at all this patient is having a very forceful valsalva maneuver with an occluded eustachian tube, the ICP increases, the pressure increases. So the pressure in the inner ear increases. So the pressure in the inner ear increases. So what happens if the pressure in the inner ear increases? It's going to rupture all these membranes. The oval window, round window, everything gets ruptured. There will be a window created. Okay. At this point of time, suddenly the eustachian tube also opens. What will happen? There will be pressure from here and pressure from eustachian tube as well. So the pressure in the middle ear cavity is going to be very high. It can damage the middle ear as well. Okay. So this is the mechanism of inner ear barotrauma. Okay. Come again. So how is the inner ear barotrauma happens? When the patient dives from 0 level to 33 feet below sea level, the patient is going to experience 2 atmospheric of pressure. So when the pressure doubles, the volume of the air is going to be halved. So the middle ear cavity, the air volume is halved. There's going to be more of vacuum. The vacuum is going to have a suctioning effect. So now the patient is doing a valsalva maneuver, forceful valsalva maneuver, which is going to increase the pressure in the brain, thereby increasing the pressure in the inner ear as well. this is going to rupture the connection between the middle and inner ear. That is the oval window, round window, everything gets ruptured and creating a fistula there. At this point of time, if the eustachian tube also opens, there is pressure coming from the inner ear to middle ear and through the eustachian tube also to middle ear. So, the middle ear box has huge pressure. This is mechanism 2, right? So, if a diver attempts a forceful Valsalva maneuver to equalize the middle ear against an occluded eustachian tube, that is mechanism 1, okay? The pressure differential between the CSF transmitted through the vestibular and cochlear structures and the middle ear airspace can cause a rupture of the oval or round window, fistulization of the window, tearing of the vestibular membrane. Hope the concept is clear. The second mechanism is, additionally, if the driver is able to open the eustachian tube at this point of time, a rapid increase in the middle ear pressure occur. Okay, this pressure wave is transmitted to the inner ear and it can cause injury to the inner ear as well. So, how is this inner ear barotrauma going to present? Unilateral roaring tinnitus, sensory neural hearing loss, profound vertigo, and on your examination, fistula test may be positive. What is fistula test? This is a pinna, right? Okay. This is a tragus. By fluctuating the pressure in the external auditory canal, you will be able to elicit vertigo or nystagmus in this particular patient. Okay, this is called as fistula test. Okay, so how are you going to increase and decrease the pressure? How are you going to actually increase the pressure? By directly pressing the tragus multiple times also, you will be able to fluctuate the particular pressure in the external auditory canal. Or you can have a separate fistula checking machines also with a small bulb. You can inflate and deflate so that you can increase and decrease the pressure in the eustachian tube, in the external auditory canal. So, if there is a change in the external auditory canal pressure, if it is inducing a nystagmus, it means that fistula test is positive. It means that there is IEB. So, inflation of the tympanic membrane on the affected side causes the eyes to deviate to the contralated side and production of vertigo. This is called a fistula test. So, what are the immediate complications of IAB? Of course, the patient is going to get panic, disoriented. This is happening at the level of 66 feet or even 100 feet down, right, inside the water. So, you may get panic, disorientation. This can lead to drowning and of course, the rapid ascent predisposes to pulmonary barotrauma as well. So, how are you going to manage? So, most of the time, it's going to be an immediate exploration. But there are certain authors who place their bet on trial of bed rest, head up position, medications to control vertigo, mechanical measures not to increase the CSF pressures like stool softness, no nose blowing techniques and stuff. So, where they actually document or they advise to go for this immediate exploration is when the patient has severe hearing deficits or significant abnormalities on the ocular nystagmogram, then they can go for immediate exploration. There are two schools of thoughts. One is directly go for immediate exploration, or second, you can try this conservative management and then go for immediate exploration. There are two schools of thoughts. Very much afraid of this kind of rupture of internal ear issues is most of these patients who come with this decompression sickness or bubbles, air bubbles inside their tissues and stuff, this patient can be subjected to hyperbaric oxygen therapy, right? But if at all there is an inner ear issue, there is pressure fluctuations, and if you subject these patients to HPO, then you're going to worsen the injury, okay? So, if these patients were having an ear issues, you're going to subject for HBO for any other reason, then they require urgent or emergent tympanostomy. Only then you can subject them to any pressure related things, okay? Do a proper tympanostomy, then only you can subject this patient to pressure effects. Otherwise, this pressure effects is going to worsen the patient's condition. So, other small things is like face squeeze can happen, tooth squeeze can happen, dry suit squeeze can also happen. These are all the complications, okay? So, what are these? The face squeeze. So, now I have a mask, okay? I'm just placing it over my face. So, there's going to be air, there's going to be space between my face and the mask, right? So, this space also contains some air. So, when I'm going deep, because of the increase in pressure, the volume of air here is going to be halved. There's going to be vacuum. This vacuum is going to suck the nearby things. So, by all these things, my face is going to get pulled in, right? Pulled inside that cavity. Okay, this is called as a face squeeze. This can produce facial bruising, conjunctival injection or hemorrhage, changes in vision, or sometimes even retrobulbar hemorrhage, which is actually a ophthalmologic emergency. What is tooth squeeze? When air space inside a tooth, okay? Have you seen the tooth with a small air space inside? Okay, X-ray of a tooth, you'll be able to see a small air space inside. Either that or it's a decay. the patient is having a decay, or the patient is having an abscess, or any fillings is done here, any small air spaces is left, all these things can become compressed during the descent, and this can cause pain. What is dry suit squeeze? A dry suit squeeze occurs when the suit folds are compressed onto the underlying skin, producing local trauma. It's like a tight fitting dress, because there will be some air between your dress and the skin, right? Even that also gets compressed, and it can also produce some painful streaks. This is called as dry suit squeeze. Okay, this is what you need to understand about what happens when you go inside the water. Okay, this is barotrauma of descent. Okay,